What would you do if your doctor missed a cancer diagnosis for 2 years? That's exactly what happened to today's guest, Jenny Bradley. But instead of letting fear take over and get the best of her, Jenny chose to thrive. And she's here to share how she's been thriving with cancer since 2017. Hi, I'm Debbie Sadie-Fly, and welcome back to day 71 of our Proven Cancer Strategies Revealed 90 Days to Cancer Resilience. In today's clip, you'll hear Jenny's powerful story of misdiagnosis and how she embraced an integrative approach and the role that nutrition plays in her healing journey. Jenny's insights will inspire you to advocate for yourself and take charge of your own health no matter where you are in your cancer journey. Let's dive into Jenny's story and her wisdom now.
Jenny Bradley has been thriving with a cancer diagnosis since 2017. She equips others to confidently advocate for themselves using integrative approach to care and intentional anti-cancer nutrition. Jenny helps guide fellow cancer thrivers into more peace and less overwhelm on their healing journey. She has a Master's of Art in Intellectual Leadership and is a certified culinary nutrition expert and a certified cancer coach who shares her cancer insights and tips at shrinkingthemutantschool.com and at shrinkthemutant on Instagram. Jenny lives in central USA with her husband, Mike, and their little dog, Poppy.
Hopefully we won't hear the little dog Poppy in this.
Yeah, I hear you on that one. I always say you never know when you're going to get the barking or somebody comes to the door, right?
Yes, but we know there's health benefits to having a pet, so we'll keep her around.
All right. Okay, that's good. Hey, maybe we could expand on that as we go.
Yeah.
So maybe you could start off and give us a little bit about your story and also what motivated you to set up your Shrink the Mutant school and website.
Yeah, so essentially I was misdiagnosed for 2 years. I had a bump on my chest that the doctor just kept saying, literally, quote, "I'm not worried about this being cancer." And at that time, why would I think to second guess a doctor? It wasn't cancer, honestly, wasn't even a thought in my brain. That's what it was because this doctor was so sure that it wasn't. And then on the last year of that, she happened to say, "I'm going to send you to a specialist because they, quote, cut these out all the time. So you'll have a better aesthetic outcome." She said, "I could do it for you, but I'm going to send you to somebody else just so you can have a better outcome." So I went to that appointment many months later because, again, no one thought that this was an emergent situation. So I went to that appointment many months later and took my husband because we thought that we were just going to be scheduling a little small procedure. It was a consultation for a procedure. And within the first moment of that doctor literally looking at me before she touched anything or whatnot, she said, "I'm so sorry. I'm pretty sure this is cancer."
Wow.
And brought in the ultrasound and wanded me and said, "This is not fatty tissue. This very much has the hallmark signs of what cancer looks like on an ultrasound." And so she said she wanted to do a biopsy. So in that moment, I just went into business mode, honestly, because I didn't go to that appointment thinking anything about cancer. So there was no working myself up and there was no needing to work myself down because it just wasn't on my radar. And so we just went into business mode. Literally, I talked about insurance in that moment, that we hadn't met our deductible for our insurance yet. Could we wait a few more weeks until the year rolled over? And the doctor said, "You've had this bump for a couple of years." And I said, "Yes." And she said, "Then 2 weeks isn't going to matter." And I think that in and of itself is very telling, right? Not all cancer cases are immediately urgent, and you don't have to get on the conveyor belt of conventional care immediately tomorrow type of thing. So that gave us a pause of a moment to have a conversation between my husband and I of, do we want to go ahead and have the biopsy today and have the information sooner than later, or do we wait? And then we loosely talked about it and we decided, oh, let's just have the biopsy right then and there type of deal. And again, at that time, I had no other information in my life about a biopsy in the sense of what concerns there might be around having a biopsy done. And so again, that wasn't anything I was working my way up to or had to mentally work my way down off of. It was just, that's the next procedure. So did it in that moment and then pretty much left that medical office feeling like, okay, that doctor is so sure that this is this what cancer looks like, that I probably have a cancer diagnosis. And
Mhm.
so literally that night, without officially having a cancer diagnosis, I started researching that night. And I bought my first books about cancer that night in 2017. And then later that week, we got the phone call that yes, indeed, it came back as a carcinoma and that they needed to send it out for further testing to get the full pathology report of it. And so it was around the Christmas holiday. And so
Mm.
they let us know that normally this would all be a speedy type of thing, but because of the holidays, you're probably going to have to wait longer because all these offices are going to be closed this day, that day, etc. And so it was a type of thing of, if you haven't heard from us by January 2nd, then call us. But anyway, so I found out the full pathology a weekish later, and within 2 weeks, I had already gotten an appointment with an integrative naturopathic care clinic and ended up having that appointment actually before my conventional oncology appointment was able to be, just because of their schedule too.
Mhm.
So that led me on a path right away to have I would say, a more robust understanding that cancer wasn't just a one spot on me that we needed to deal with, but we needed to deal with the entire Jenny, the entire terrain of my whole body. And thank goodness and thank God that naturopathic doctor
Mhm.
was able to immediately start helping me get my hormones back on track, get my vitamin nutrition level within my body in a better balanced place, etc. So that started my journey in 2017 and then into 2018. And within a few months, I had friends encourage me to make my journey and all these different things I was doing that they weren't used to seeing or hearing about, to make that public. So I moved my Instagram account, my Shrink the Mutant Instagram account, from private to public so other people could learn about these different integrative methods and whatnot. And I would literally show people on Instagram, I would do stories and posts and whatnot about what does it look like to have an IV vitamin C? What does it look like to do an infrared sauna? What does it look like to juice a bajillion ounces of juice a day, or whatever the things were? And then along with that, what does it look like to do an anti-cancer meal and whatnot? So all kinds of things over the years. And now 5.5, almost this winter, it'll be 6 years. 5.5 years later, have morphed into the different world of I want to continue to help people by showing them my story and helping. Sometimes it's all you need, sometimes is somebody that's a step ahead of you. And so I'm honored to come alongside fellow cancer thrivers, fellow cancer patients, and show them a little bit more of what the ropes looked like that I went through. And maybe that can help them make some more educated decisions, some more informed choices on their side of things, and to know that they're not alone, right? We're not alone on this cancer journey. And so if I can be somebody else's cheerleader and supporter, that makes all of this worthwhile in a lot of ways.
Wow, that's really inspiring, I have to say. What a great, it's not a great story, but to make something positive and to talk about thriving when you get a cancer diagnosis is really inspiring.
Yeah,
I
I
think
think so much of it from the first part too was a lot of those books that I read from the very beginning of, even before I had that official pathology report, they were very evidence based, written by MDs and PhDs, but they were really about what we can do to support our entire healing journey. And so much of that is mindset. And so I came at this from the get go of hope is the biggest drug in and of itself. And if I had a healing mindset that this is possible, then I was willing to do a lot to take care of myself and whatnot. So I did all kinds of integrative care options. I should say, just for people to know too, I'm never trying to hide this idea. So surgery was not immediately recommended in my particular case. Radiation was absolutely not recommended for my particular body. Multiple doctors said that. And chemo was not recommended for my particular pathology. I was in this kind of weird place of conventional oncology. Literally the only thing that they could offer me was one drug in my particular case. That, by the way, some of the side effects are another type of cancer
no.
or strokes or another wide list of things, right?
Jenny's story is a powerful reminder that we are in control of our own health journey. Her approach to integrative care and nutrition is both empowering and inspiring, showing us that we can thrive even with a cancer diagnosis. If you found Jenny's insights valuable, please like and share this video and stay tuned for more expert interviews in the Proven Cancer Strategies Revealed series. Plus, don't miss your chance to join us and gain access to all 25 expert and survivor interviews. For details, click in the link below to sign up. You'll get emails every day with those expert interviews and the full interview, not just the clip. And thanks for watching. And remember to stay resilient.